Hello, it's Dr. Rhonda Johnson. Today is Wednesday, October 13th, 2021. And today I'm going to be discussing in-school testing for COVID. Recently, I had the opportunity to watch a testing program conducted in a school. And full transparency, this was part of my work as a paid consultant for Ginkgo Bioworks, a company that the Pennsylvania Department of Health has contracted with to do in-school testing with schools across the state of Pennsylvania. But it was my first time actually witnessing how a program could be run and conducted. So I went and I observed a very small private school. The students were diverse and they ranged from babies to sixth graders. The school in question does pool testing on students and staff once weekly. Contracted nurses provide the testing. I went with them from classroom to classroom. The students lined up in the hallway, and many children performed their own nasal swabs. And they were as young as 3 and 4 years of age. The nurse would demonstrate what was to happen. She would put her hand over the student's hand and guide them. Now, of course, the older students did it all by themselves. And by older, I'm talking about kids as young as 5 and 6 years of age. And what she would say is, let's just swab your nose, and a small Q-tip would go inside the nostril to a count of 1, 2, 3, 4, and then 1, 2, 3, 4 in the other nostril. Again, that's all it takes. And the swabs were placed in a tube, labeled for each classroom. Each student swab took less than a minute, as you could see as I did this. And the nurse gave students hand sanitizer before and after they swabbed their noses. And then the students went right back in their classroom. Of about, I'd say, 160 students that were tested that day, at least, only 2 students resisted. They cried a little bit, and they were the younger students, and they were quickly consoled by their teachers. I was able to ask some of the older students what they thought about the testing at school. And again, it was their 3rd week of testing. Their answers ranged from, no big deal, I don't mind. And one young lady said, it's disgusting and gross, but I'll get used to it. Like most schools, this school has battled COVID cases. They have a COVID policy, which is based on CDC guidelines, and they require proof of negative rapid tests before school re-entry if a student has tested positive in quarantine at home. The students wear masks all day in the classroom, and the teachers and staff repeatedly inform me that the students do just fine with masks, and the teachers do just fine wearing the masks at school. So it was good to see how this can be done and how it can be done successfully. Now, the most recent data that I could find shows a total of more than 220, 2,238 schools across 561 districts in 45 states that have had to temporarily close or pivot to virtual or hybrid learning since the school year started in August because of COVID. Now, the good news, according to the CDC, is that 96% of schools in our country's public education system are fully open for in-person learning this school year. Now, I really thought, based upon my observation, that the school's testing program that I observed was a huge success. It was minimally disruptive to the students and the staff. It certainly did not create any psychological harm. And it's necessary because as schools move into the cooler weather this fall and winter, they're going to likely see more COVID cases. And schools that have started this process will be ready because they have a system in place to keep schools open. You know, back in March of this year, our federal government announced that it was making $10 billion available for K-12 schools for in-school testing. Here in Pennsylvania, this program is coordinated through the Departments of Education and the State Department of Health. And I really have to say, parents, if your school district does not have a testing program, you should inquire why not. And why is this important? besides the fact that kids get a chance to stay in school, have less disruption, parents have less disruption, the social and psychological benefits for children to be in school is so established. But let's look at consequences for adults and school employees and school staff. We'll start off looking at Georgia. Since the start of the school year, at least 50 teachers and staff members have died of COVID-19 since July when the school year started. The youngest was just 24 years old. They are teachers and coaches and bus drivers and school resource officers. They are administrative assistants and daycare teachers. They are lunchroom staff and education specialists who all died from COVID. In Miami-Dade County Public Schools, at least 13 employees of the Miami-Dade Public School Systems have died from complications of COVID in the first month of the school's reopening. In Tennessee, 8 Tennessee public school employees died from COVID in the first month of school. And there may be more of these. We don't know because there's no government or private agency keeping a comprehensive count of deaths from COVID in school employees. Now, I don't know the vaccination status of these employees. This is just information I could find. We all know the politics of COVID, and the COVID vaccine, unfortunately, remains very political. But the education of our children is essential for their future well-being in society. I always keep reminding us, let's not forget what we're dealing with. We're dealing with an invisible virus, which as of October 7th have infected over 6 million children who have tested positive for COVID in the United States. And the number of new child cases for COVID remains exceptionally high. Almost 1 million children tested positive in the past month. Now, the good news is that severe illness due to COVID-19 is uncommon among children. But that certainly is not the case for adults who are essential for them getting educated in school. Let's get more testing in our schools. It's free to school districts, and with a little bit of practice can run smoothly. That's my message for today. As always, my views are my own and do not represent the views of any consulting agency that I may be affiliated with. My views are my own. That's my message today. Stay safe, folks, and as always, have a blessed day.